Welcome to our video lecture on observational studies. This lecture will discuss different research design that is under observational studies. Our objectives are the following: to compare and contrast prospective and retrospective study designs, differentiate between incidence and prevalence, describe and differentiate between observational study designs, and list the advantages and disadvantages of each observational study research designs. For overview on observational studies, this group of research designs conduct direct observation of natural relationship between exposure and outcome, such as epidemiological study. In this type of research designs, no protocol researchers merely record what happens to people in different situations. Interventions exposures are driven by individual preferences, practice patterns, policies, and etc. Also, it demonstrates associations between exposures and outcomes, but cannot prove causality. Observational studies are highly generalizability with real-world population, and it is best way to study dangerous exposures. When you compare study design according to experimental and observational, experimental research designs needs intervention or treatment. It needs a patient to follow a protocol and it looks for cause and effect. While on the other hand, observational research designs are non-interventional. No intervention is needed and no protocol should be followed by the patient. It just looks for associations between variables, such as exposures and outcomes. It is used to check or to look for probable causes of disease, probable risk factors and protective factors of diseases, occurrence of drug use problems such as adverse events and harms. In terms of timeline of data collection under observational research designs, it has longitudinal and cross-sectional. In longitudinal, it can be divided into prospective and retrospective. Prospective data collection measure exposures or intervention before outcomes occur. It is carried out from the present into the future, while retrospective collect data on exposure or interventions after outcomes occur, and it looked to the past to examine the occurrence of medical events or outcomes. On the other hand, cross-sectional data collection collect data at a single point in time or snapshot. Furthermore, to compare prospective and retrospective longitudinal timeline data collection, prospective collection is expensive to conduct while retrospective is inexpensive. Prospective needs long time to complete while the other one needs short time for completion. Prospective data gathering is more difficult to access subject and usually requires larger number of subjects. On the other hand, retrospective has easier access to a larger number of subjects. Prospective data gathering may have an exposure status and diagnostic methods for disease that is variable, while retrospective obtain results quickly. Prospective timeline may have lost subjects from the study over time and may be substantial, while retrospective subjects may not remember or subjects can have historical exposures. Prospective research designs direct access to study subjects and enhances reliability of data, while in retrospective, subjects may not be able to remember the past information. Prospective research designs may have information or data which is more complete and accurate, while retrospective may have less complete and inaccurate data. The first type of observational research design is the epidemiology. It talks about incidence and prevalence. As defined, incidence is a number of new cases of disease in a population in a given time period. It is a measure of the risk of developing a condition within a specific period of time. The unit for measurement of incidence is rate, while prevalence is the total cases of disease in a population, a measure of the burden of the disease on the society, and the measurement unit is using proportion. The use of epidemiology answers the following question: what is the risk of acquiring the disease? And how widespread is the disease? To further understand prevalence and incidence, check the picture attached in the slide. To compare acute disease and chronic disease in terms of prevalence and incidence, acute disease, the incidence is high, wherein the number of new cases is higher than existing cases, while the prevalence of acute disease are low, which is because of quick recovery or maybe death occurred. For chronic disease, incidence is low, meaning the number of new diagnosed patients is lower than the number who have already the disease, while chronic disease have high prevalence,